Let's bring in now NBC News medical contributor, Dr. Natalie Azar. She's a doctor of internal medicine specializing in rheumatology, but she's spent several days over the past week working on a COVID floor at NYU Langone Hospital in New York City. Dr. Azar, it is so great to see you. Thank you for the work you've stepped up to do inside that hospital. We've heard about the problems with personal protective equipment. We've heard about the problems with ventilators. What is your experience over the last week? What did you see and hear on that floor?
Yeah, well, first, Willie, let me just I just need to acknowledge my colleagues and healthcare workers all across the nation who've been doing this since day one. What I did last week really just feels like a drop in the bucket. And I will also say that there are many, many times as a trainee, as a medical student, as a doctor, where you feel like it's such a privilege to take care of these patients. And last week truly was that for me. To your question, some observations that I thought were really, really interesting was this dichotomy between reporting on something and then actually going to the proverbial front line and seeing what it was really like. And, what happened in my hospital isn't necessarily reflective of what's happening in the nation. But I will say that, for example, we talk about these two distinct groups of patients who declare themselves quite early, those who do well and those who decline very rapidly. And that was certainly the case. A couple of other things that I think are worth mentioning. We talk a lot about how these patients are so isolated, and it's so true. The patients that we were taking care of were each in their own individual rooms. The number of times that healthcare workers were asked to or needed to go in to be by the bedside was really restricted, because each time we did that, we did have to don and then doff the PPE. We had enough supply, thank goodness. The ventilator issue wasn't an issue for us at NYU at the moment, but we were always told to be very, very careful that we didn't want to squander those resources. And then lastly, I would just say that the collaboration, again, between the nurses and respiratory therapists and all the doctors and all the people involved in the patient care, it really was a matrix that was keeping the whole thing together. And I just have the utmost respect and admiration for all of those people.
Well, it's incredible, and we appreciate the account from inside. I want to ask you quickly, Natalie, about the bigger picture and flattening the curve. We've heard hospitalizations are down in New York. That's good news. Deaths are up, which the governor has called a lagging indicator. Where do you see this headed next nationally?
So, I think that the trajectory epidemiologically is exactly what we were anticipating, that the social distancing would end up helping to flatten the curve, and that we will see, hopefully, to get on that other side of the curve. But as Dr. Fauci always says, I think it's such a good way to describe it, now is not the time to take the foot off of the pedal. You can analogize it to so many different things. I've said, if you're undergoing chemo for cancer, you wouldn't stop that as soon as there was a tumor response. And I think that is very, very apt here. I think there are a lot of issues that are at play in terms of, or a lot of considerations, I should say, about reopening the economy. Some are medical, some are public health related. The testing, do we still have enough, out there to test for acute infection and also antibody testing for surveillance? I think there's a lot of factors that need to be considered, before we start reopening. And those are the kinds of things that we will be thinking about in the weeks to come.
Well, Dr. Azar, we've known you as a friend and a colleague over all these years on so many medical stories, and we're so proud of you for running to the front lines this week. Great to see you.
Thanks, Willie.